Welcome to our channel HASHMICLINICS.
All right, when it comes to acute remedies, there are very few that hit with the sheer speed and raw intensity of Amylenum Nitrosum. So today, we're going to do a real clinical deep dive into this powerhouse. This is for all you practicing homeopaths and senior students out there who really want to get a handle on its application. You know, to move beyond just the textbook and into effective real-world prescribing. So here's our game plan. We're going to start with the absolute core of the remedy, then walk through the physical picture, look at the clinical triggers, compare it to some other remedies, and finally wrap up with some key prescribing essentials you can take with you. Okay, let's get right to it. The absolute heart of Amylenum Nitrosum. Look, if you remember just one thing from this whole explainer, let it be this. Its action is a sudden, totally overwhelming physiological storm. Getting this concept is the key. It unlocks the entire remedy picture. I mean, this quote just says it all, doesn't it? We are not talking about a gentle warmth or, a simple blush here. This is a violent, chaotic, overwhelming circulatory disturbance. The patient literally feels like the blood is going to burst right through their skin. That's the foundational image you need to hold in your mind. So what's actually going on under the hood? Well, the mechanism here is crucial. Amyl Nitrosum goes straight for the vasomotor nerves, and it causes this incredibly rapid, widespread dilation of the tiny arteries and capillaries. Don't think of it as a slow buildup. No, this is an explosion of blood to the surface, especially from the chest upwards. And this intense physical storm, well, it's perfectly mirrored in the patient's mind. The circulatory chaos on the inside shows up as this profound anxiety and terror on the outside. It's a feeling that something absolutely dreadful is about to happen. And that feeling drives this overwhelming restlessness, this desperate, almost primal need to just escape, to get out into the fresh, open air. Okay, so how does this central vasomotor storm actually translate into physical symptoms? Let's start mapping out the keynotes, starting from the head and working our way down. Let's see how this whole picture unfolds. Well, as you'd probably expect, the head takes the full force of this upward rush of blood. Patients will tell you about these intense, bursting, throbbing feelings, and you can often actually see the pulsations in their temples. Their eyes might look like they're protruding or staring, just as if they're under immense pressure. Now, the face gives you a huge clue for your diagnosis. You get this characteristic scarlet flushing that's triggered by the slightest emotion. And pay attention to the throat, that feeling of constriction, that sense that the collar is just too tight. That is a classic keynote. We see it in other remedies too, like lachesis, so being able to tell them apart is critical. And also, keep an eye out for these peculiar, kind of involuntary munching or chewing movements. The heart, well, it experiences this storm with just as much intensity. The palpitations aren't just flutters, they're described as tumultuous and violent. This makes it a top-tier remedy for angina pectoris, especially when there's this great agony and constriction. The pulsations are often so powerful, so widespread, the patient can feel them all the way down to their fingertips. Clinically, this is huge. It makes amylenum an absolutely indispensable remedy when you're dealing with major hormonal shifts. It's a cornerstone for those violent hot flashes of menopause, especially when they come with anxiety and palpitations. And it's also for those critical postpartum situations, like convulsions or hemorrhage that have that classic red flushed face. Its fever pattern is also really characteristic. It follows this very clear, predictable path. First, you get that sudden, intense, flushing heat. But then, almost paradoxically, that's followed by cold, clammy skin. Then comes a profuse, just drenching sweat. And the whole episode concludes with the patient in a state of complete exhaustion, just total prostration. Now, beyond that main circulatory storm, you gotta remember these really peculiar general symptoms. These are often what will confirm your prescription. I'm talking about a constant, insatiable need to stretch for hours, and it's never satisfying. This usually comes with these deep, profound yawns. And of course, that ever-present, overwhelming craving for fresh, cold air. Okay, we've mapped the symptoms. Now let's talk about context. What are the specific clinical situations and triggers that should make you sit up and think, aha, Amylenum Nitrosum? This is really where the theory hits the road. Think of these as the weather patterns that can kick off the amylylum storm in a person who's susceptible. You'll notice the strong emphasis on emotional triggers, things like fright or even just excitement, but also big physiological stressors like menopause, sunstroke, or even exposure to anesthetics. In your acute practice, this is a remedy for sudden, often life-threatening crises. It's famous for giving that immediate palliative relief in an angina attack, sometimes even administered just by smelling it. It's also a go-to for the acute effects of sunstroke, certain kinds of seasickness, and it can even be used to temporarily break an epileptic seizure. But it's not just for those big emergencies. For chronic cases, what you need to look for is the pattern, the recurring theme of these vasomotor disturbances. Think about that patient who's suffered for years from excessive chronic blushing at the slightest little thing. Or those really deep-seated menopausal cases where the flushes, the anxiety, the palpitations, that's the whole debilitating picture.
Right. Now we're at a really critical step: modalities and differentiation. Understanding what makes the patient better or worse and how amylenum stacks up against its close cousins, this is absolutely vital for a precise prescription. The modalities here are they're stark. They're black and white. This patient has a profound aversion to heat and stuffy rooms and a desperate corresponding craving for open, cold air. This is the person who's throwing the windows wide open in the middle of winter. Any exertion brings on the storm, while that open air brings immediate, blessed relief. So let's put amylenum head-to-head with its closest relatives, glonowinine and lachesis. This is a common point of confusion. Glonowinine is also sudden and violent, but you want to think more of bursting, throbbing pains with a really clear aggravation from the sun and from being jarred. Lachesis is usually a bit more gradual, with those constrictive feelings that come in waves, and of course, it's classic aggravation from sleep and light touch. The real defining feature for amylenum is that tumultuous surging quality, with that profound, undeniable relief from cold, open air. And finally, let's distill all of this down into a few actionable clinical tips, some pearls that will help you use this remedy effectively and accurately in your own practice. This quote from the literature, it highlights a critical duality that you absolutely have to understand. Using the crude drug or low potencies by inhalation will give you rapid, temporary relief in a crisis. It's palliative. But for true, deep, constitutional healing of the underlying problem, the sources are crystal clear. You need to use higher potencies. So what does that mean in practice? Well, for that curative constitutional prescribing, the classic Materia Medicas and loads of clinical experience consistently point towards the 30th and 200th potencies. That's the sweet spot for addressing the chronic state. And here are just a few simple memory aids to help this stick. Associating these vivid images with the remedy can be a lifesaver. So if your patient is the emotional blusher, the unsatisfying stretcher, the color loosener, or the fresh air craver, Amylenum Nitrosum has got to be at the very top of your list. So I'll leave you with this question to chew on. How do we, as clinicians, make sure we avoid the trap of just palliating, of just putting out fires, and successfully move the case toward a deep, curative action with this incredibly powerful remedy? Really thinking about that will sharpen your prescribing for years to come.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.